Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 15 new cases of COVID-19, bringing our total to 182. We're also announcing our second death related to COVID-19, bringing our total number of deaths to 2. And our condolences go out to the friends and family of that individual. As of this morning, 9 individuals are hospitalized. Of that, 6 are in intensive care. Our reports indicate 11 individuals listed as recovered. Public health investigations are continuing to confirm details, and information will be updated on our website as it is made available. Yesterday, 634 tests were performed at Chatham Provincial Lab, bringing the total number of completed tests to 11,952. We are continuing to ask all Manitobans to take significant precautions in their day-to-day activities. We are advising Manitobans to stay home whenever possible. If you must go out, practice social distancing at all times. Keep that 2-meter separation between you and all other individuals. Avoid groups of people. But most importantly, stay home if you can. And again, now that we see this virus in parts of our communities, it's important to take these measures at all time, no matter where you are in Manitoba. Stay home, whether you are aware of cases reported in your community or not. Stay home, practice social distancing at all times. Staying home is especially important if you're ill. If you have a fever, cough, runny nose, sore throat, stay home. If you have questions, call HealthLinks. If you have shortness of breath or feeling quite unwell, you may need medical attention, and HealthLinks can direct you in that regard. Our testing criteria continues to be all symptomatic returning travelers, as well as symptomatic healthcare workers, and those symptomatic in congregate settings such as correctional facilities. Those are on our priority list, namely because of concerns should a virus be introduced into congregate settings. The chances of spread are increased, so many procedures are in place to limit the possibilities of that. Our testing priority also includes First Nation communities. I want to reiterate that people should continue to seek medical care for non-COVID issues. People with underlying medical conditions or conditions that may be developing should still seek medical care as per usual. If you're under the care of a physician, ensure you're following the advice, and regular follow-up may be required as per your physician. Much of this care could be done virtually, but I advise you to keep in touch with your healthcare providers and continue to follow their advice during these difficult times. I'm reminding Manitobans to continue to seek out credible advice regarding COVID-19. Visit our website at manitoba.ca/COVID-19 for up-to-date information about this virus. These are challenging times for us all. We're seeing our case numbers continually grow. We're seeing severe outcomes, which is quite distressing to many Manitobans. But again, this is not the time for fear. This is the time for our actions. And by staying home, we're interrupting the transmission of this virus. Staying home and practicing social distancing, all Manitobans are doing their part to limit the number of days like today. So I want to thank all Manitobans who have already stepped up and doing their part, and encourage all Manitobans that we all have a role in preventing days like today. Thank you very much.
Thank you. Good afternoon. I want to start today by thanking Manitobans who have responded to our call for help in boosting our stockpile of supplies for COVID-19. As we have said multiple times, the requirements and challenges that we face change daily and require swift action and constant contingency planning. We are well stocked at this time for weeks to come, but we must take every step we can to prepare for this virus that has overwhelmed other health systems throughout the world. That is why it has been so heartwarming to see the community pull together at this time. 8 different organizations stepped up the day after we put up a call for donations. And the very first company was Star Building Materials, who donated 195 masks because they felt it was the right thing to do. So thank you. In the first day after putting out our call for supply donations, we received 2,570 N95 masks, 3,100 surgical and procedure masks, 9,300 gloves, and 202 bottles of hand sanitizer. So we thank all those Manitobans participating in this effort and all the organizations for your support. We hope to keep this momentum going, and so we ask for any company who has medical supplies to step forward and help your community. These supplies include N95 respirators, medical procedure masks, medical examination gloves, disposable isolation gowns, and disinfectants and cleaners. So all supplies need to be in their original packaging. Addresses and hour of operations of drop-off sites can be found on our website at sharedhealthmb.ca. Working together is how the province is going to get through this. HealthLinks continues to see thousands of get thousands of calls every day. So yesterday there was 2,200 calls. There was a temporary power outage, but on average the wait times was 23 minutes. The online self-assessment tool had 8,000 views yesterday for a total between the French and English tool 380,000 views. Dynacare continues to call patients who tested negative for the virus. Yesterday, they made approximately 1,300 calls. And a reminder that people who are positive for COVID-19 will receive calls from public health directly and immediately. Community testing sites. So a second screening site is now open on Main Street at the MPI Service Center. Hours are 9 till 5, 7 days a week. Other Winnipeg locations include the Mount Carmel Clinic, Access Winnipeg West, and MPI's Bison Drive Service Center in Fort Garry. As a reminder, now that we have that Main Street MPI Center up and running, Access Transcona and Access Fort Garry will no longer be testing sites for COVID-19, and the staff have been redeployed to the other sites that are higher volumes. Community testing sites are not walk-in clinics. A referral is required to go there. And finally, across Manitoba, we know that patients in hospitals and long-term care facilities are living a new reality with limited or no visitors. And these restrictions, of course, are there for a reason, but we appreciate how hard it is for patients and their families. I previously mentioned efforts by several hospital foundations to raise money for electronics to keep patients and residents connected to the outside world. But putting pen to paper or fingers to keyboards is another excellent way to send well wishes. Many hospitals have well wishes programs, and these are inboxes that welcome the thoughts, love, and prayers for their patients or residents. So a single email or a kind word can lift our spirits in measurable ways. So while Manitobans are self-isolating and socially distancing, I encourage everyone to consider what messages they could send to lift the spirits of someone who's not surrounded by their family at this time. Information is available on hospital and health region websites, and of course you can send well wishes to healthcare workers at community@sharedhealthmb.ca. And with that, I will open the line for questions.
Thank you very much. A reminder to our journalists online, you get a question and a follow-up question. And please reintroduce yourselves before asking your questions. From the Brandon Sun, Bud.
Yes, Bud Robertson, Brandon's son. The Premier mentioned this morning regarding a request for proposals for low acuity hospitals or facilities in Brandon and I think Thompson. Could someone expand on that? Give me a little more information about what this is?
Yeah, so work has been going on looking at hotels and inns and vacant apartment spaces, as well as these potential pop-up places. So those are, we're looking at all options, mostly for self-isolation. If medical care is required, those people need to be in a hospital if they need oxygen or suctioning or anything more intense than just self-isolation. But self-isolation is really, these isolation centers are what we see as an important way to stop the spread of COVID-19.
So the follow-up, there'll be no nursing follow-ups, no monitoring of any sort at these, you're thinking?
Well, if you are positive and you need to go in isolation, so if your home dwelling has people who are maybe higher risk, have chronic disease, or it's challenging for you to self-isolate in your own home, this would be an option for you. And if you were positive or a contact, just like everybody else, you would still receive the public health follow-up, the daily follow-up and the surveillance. So that would still happen.
Okay, thank you very much.
From Lowell, Brittany.
Good afternoon, Dr. Roussin. I know we've asked you a number of times about people wearing masks, but we're expecting the CDC today to recommend wearing a cloth mask or a mask for everybody whenever they leave the home. Have you changed your outlook on this at all?
It really doesn't change my opinion on it. The issue here is that if we're concerned about this virus, as we all should be, we should be staying home as much as we can. If we go out, then we should be practicing social distancing at all times. If on top of that you wanted to wear a mask, then perhaps there's that added benefit of not touching your face. If you're using a homemade mask, difficult to know if it actually provides a benefit. But it should not change your behavior. It should not make you want to leave the house more than you would before. It should not make you want to let down your social distancing practices. So for the most part, it's not a recommendation that I would strongly make. My recommendation is stay home. And if you have to go out for necessities, then practice social distancing at all times.
And my follow-up on that is we talked a lot about care homes yesterday. We've heard of possibly workers at 2 other care homes who've tested positive. Can you confirm that and give us any update on the care homes we spoke about yesterday as well?
I don't have any knowledge of any other personal care homes of positive tests in workers. I know in the Beto home in Gimli, we have been following that up, and as of just coming on, there was 7 of the 9 residents tested negative for COVID-19 and still waiting on the other 2 samples. But I don't have any other information on other care homes.
Thank you.
From the Winnipeg Free Press, Larry.
Yes, Larry Cush, Winnipeg Free Press. The Manitoba Nurses Union is saying today that at least some of the nurses at Health Sciences Centre who were told Wednesday to self-isolate for 14 days are being asked to return to work sooner than that if they are asymptomatic. I'm wondering if that's true, and why would that be done if it is true?
So that may be true. I can follow up for sure if that communication has gone out. But the issue is with the universal personal protective equipment that is meant to protect staff. If there are people who really were not in close contact. I think it depends on the situation, so I'm going to have to follow up on that, Larry. But I think if they were not in direct contact with an infected individual and they are asymptomatic and everyone is using universal PPE, that may be the direction that we're going.
As a follow, I'm wondering, are tests for healthcare workers being fast-tracked in any way, and especially ones who may have been asked to self-isolate? Would there be a benefit? Wouldn't there be a benefit of fast-tracking tests with these individuals to quicken their return?
The healthcare workers are a priority group, so they do their samples are prioritized at the lab.
But you said today that symptomatic healthcare workers are a priority group. But it's not clear to me whether folks who have been asked to stay at home, who are workers, are also a priority group.
There's no benefit in testing people without symptoms. A negative test in a person without symptoms is not reliable. They could still be incubating that virus. So there's no indication to test asymptomatic people, but certainly symptomatic healthcare workers, they're a priority group.
Thank you.
From City News, Stefan.
Heather, Stephanie Lucic from City News. Just wondering, when Manitoba had its first death, you released the age range and that it was from the Winnipeg region. Just wondering if you can give us any more details about this death or why not.
This is a gentleman in his 50s with a Winnipeg region with underlying medical conditions.
Okay, and then can you also give us any details about the people who are hospitalized? Are they those people in those high-risk categories that we've talked about before, over 65 with underlying medical conditions?
Many of them are. I don't have a complete list here. We're hoping to be able to provide that type of running information going forward.
Thank you.
From the Canadian Press, Steve.
Oh, hi, Steve Lambert from the Canadian Press. I was wondering if you can clear something up for me. Any hospitalized patients who have tested positive, are they in completely separate areas and being dealt with by healthcare workers who don't go between their area and sort of the general population?
Well, if there's only one person in a hospital, so we've always said that this is a provincial approach, so there may be, for example, one person admitted to Selkirk, so everybody would be isolated in a room by themselves, and personal protective gear would be worn, and all the infection prevention and control would be upheld. The staff likely would have more than one patient, but with the precautions in place, that would be the protocol. As these numbers continue to grow, they will be co-located on specific units, COVID units, but it won't be at one hospital, it'll be at several hospitals, and just because the way our critical care capacity is set up. So I think, does that answer your question?
Yes, it does. Thank you.
Okay,
and Dr. Roussin, you mentioned that we're seeing not only the numbers climb, but we're seeing more severe outcomes as well. Where do you think this puts us on the curve?
So it's if we're looking at it at the statistical rates that we see in many jurisdictions, it's within that range, where we see typically about 80% of individuals not requiring any hospitalization, where there's 15% typically are more severe illness, and in a case fatality rate of 1 to 2%. And so it's statistically what we'd accept, and I mean, certainly it's a good question and valid question. So, but I just would always clarify that to us, we none of this is a statistic for us, right? These are Manitobans that we lost, and a lot of people are working day and night to limit the amount of days like this.
Thank you.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I'm just wondering about the Riverview staff that they weren't notified about the positive case. We're doing that. So what's the protocol for telling people that there may have been a positive case or there is a positive case in a facility like Riverview?
Yeah, the protocol is the same as anywhere else. It's if you're a close contact, you will be notified. If you're not a close contact, then unlikely that you'll hear anything about it. If there's for some reason that we felt we couldn't contact all close contacts, then we would make a larger announcement.
From CBC Radio Canada, Ezra.
Hi, Robert Cousineau from Radio Canada. Hi, Mr. Roussin and Ms. Salusa. Some folks, some parents who have parents residents at the nursing home Action Marguerite in Saint-Vital, they got a letter informing them that one of the employees had been tested positive to COVID-19. The letter explained that some measures were put into place over there. Although I want to know, I guess you are aware of the case at this nursing home. I want to know what kind of communication you have right now since that case has been tested positive. What kind of communication do you have specifically with Action Marguerite as of now?
Yeah, I'll have to follow up on that. I haven't received a report of that nature. So, the typical process would be, a staff member may or may not have tested positive. Then we look to see if that staff member had been in the place of work during the infectious period. And then only then would we be concerned about, communicating with it. So I'll have to follow up in that regard.
Okay. As a follow-up, we've seen in other provinces that nursing homes for elderly has been a real problem, that there has been numbers of cases and unfortunately deaths also. Can you explain, could you explain what is your overall strategy concerning nursing homes, right now and on a long term, please?
Right. So, as you stated, this is a high-risk situation, just because there's a lot of vulnerable people living in those areas. So, very early on, we moved to limit visitation in these areas, just to limit the amount of potential exposures, screening of visitors. We've put in a number of measures with staff, and now with the moving towards the universal personal protective equipment, that's going to be another step. So we've recognized quite early on, due from what we've seen in other centers, is that very high risk if that virus is introduced there. Lynette, I don't know if you...
Yeah, I would just add, we are aware that is a high-risk population, and very early on we stopped having group meals together and group activities as well, just to ensure there was social distancing, and really doing everything we can to keep that population safe.
Thank you both for your answers. Thank you.
We return to CTV Winnipeg. Michelle, for her follow-up. Technical issue was resolved on that end. Go ahead, Michelle. Okay, then. On to the Winnipeg Sun. Josh.
Sorry.
Hi, this is Josh Aldridge from the Winnipeg Sun. Earlier today, Premier Brian Pallister talked about the concern that he has over the amount of capacity at hospitals, which is why they're taking preventive measures to see if they can increase capacity by going to the hotels and putting out requests for proposals. I'm wondering, how big is that concern? How tight are we on space currently in our hospitals and within our healthcare system?
Yeah, so it's we have been planning, as you're aware, for extra space, extra supplies, and extra equipment, and different staffing models to manage a surge when it comes. So we do have plans in place. We feel confident that we can manage what's going to come our way. However, we don't have exact numbers as to what's coming our way. So we are planning for the worst case scenario. The one thing that that would be a concern is that there are patients who are basically recovered, and this happens all the time. So it's just it will feel exaggerated if we have a lot of pressure in the hospitals. Is that there are patients who are ready for discharge, who need to go to home or a personal care home, and the community's not ready for them for whatever reason. That happens all the time. But in the case of COVID-19, when those beds are required, especially medicine and critical care beds, this would be a help to flow patients. So once their medical needs are met, if they're not ready for the community, that we can house them somewhere where they are safe and they are protected, and that there is support for them available. But it may not be at the home, and we just want to make sure that we don't get congested in the acute centers when we need to keep the flow going. Does that make sense?
Okay.
Yeah? Okay.
It does. It does. And my follow-up, we've talked about we have weeks of supplies, or weeks worth of supplies, but we're still looking for more supplies when people trying to procure that supplies. At what rate are we going through the current supplies? How many of the masks are we going through a day? How many of the gowns are we going through a day? How many sets of gloves are we going through a day? Are you keeping track of that, or what are we averaging for the rate of use of the supplies that we have?
Yeah, it's really a dynamic process. We go through thousands, as you can imagine, thousands and thousands a day. And with this universal PPE, we will go through more. So in some areas like surgical masks, we have millions of them, and we have probably over a year's supply. In other things, we may have less supply. So, and then as many of you may have heard, there is an interruption in distribution of through the American vendor for N95. So we're always looking for alternative vendors and making sure that supply chain keeps going. So in some cases, I can't give you an exact breakdown right now, but it ranges from thousands to millions, and we go through a lot of supplies every day. And we need to, because that's how we keep our staff safe and our patients safe.
Thank you.
And just a reminder to reporters on the line to please mute your lines unless you're asking a question. We're going to go back to CTV. Michelle, are you there?
I am, yes, thank you. We're just wondering about people who are self-isolating. For family members with somebody who has a positive case, should they also self-isolate, and what's the advice to those people?
So, anyone who is a close contact of a positive case would be advised to self-isolate for 14 days. So if you're a household contact, then absolutely you would be advised to self-isolate for 14 days and closely monitor your symptoms.
And now from CDC Manitoba, Bart.
CDC Manitoba, Bart McKeevis here. Yesterday, Ms. Serkis, you said you weren't aware how many people were isolating at HSC between nurses, doctors, healthcare aides, respiratory therapists, security guards. We've counted about 110 now. How many people are isolating in healthcare in Manitoba at all of our hospitals and facilities, to your knowledge?
I don't have that number for you because it's changing all the time, but we can look at possibly providing that as one of our daily reports.
So I guess the big picture, the reason I ask is not the number is that important, but to figure out the capacity of the healthcare system to respond, to figure out how many people are actually not there. So what measures is the healthcare system taking right now to ensure it's staffed up with so many people, probably getting up to 150, maybe 200 even, sitting at home waiting for the 14-day isolation to end?
So we are aware of which healthcare providers. We have a process through occupational health to make sure that we know which staff are positive. It may not be work related, it could be travel related, so we don't necessarily have the reason, but we know. And then as things are changing quickly, so when we talk about universal PPE, and when we talk about changing the travel restrictions and things like that, like it's a ever-changing situation that we will deal with. So healthcare is used to dealing with crisis, not quite this big usually, but you know, we have been through times where there are influenza situations, there's things where staff are not available to work and they have to accommodate. So it's a good question, and we are site by site, they're monitoring it because they have to manage the operational needs and moving the people around and adapting to the if staff is off versus the surge in patient demand. So it's a ever evolving situation, and it's mostly done at the site level. So I don't have those details, but we can figure out like what you want to have. There are strategies in place in terms of escalating and managing surges and looking at staffing models. So there's no doubt that having those people on isolation does challenge the system, but they're always looking for solutions.
Thanks.
From 102.9 CHTM.
Good afternoon. Dr. Roussin, I just wanted to clarify if any of the cases confirmed today are in the Northern Health Region area.
The ones confirmed today, we just received them this morning, so I don't have all of the demographics back on the ones today. I know of what's been reported to date is 2 in the Northern Health Region in total. That doesn't include any that might be in there today that I'm not aware of yet.
Okay. And in regards to how the province has been providing information about the cases, particularly in the north, people have been very upset as to how it's been handled, with how big the province and the health authority has been about these cases, especially with how large and spread out the region is compared to its counterparts in the province. Wouldn't it make more sense for the province to verify where in the north these cases are so that northern residents aren't resorting to social media posts that may not even be true to sort of and can't be easily fact checked?
Well, there's a couple of issues there. One is that by releasing that, and sometimes we promote that, right? We've heard of stories of people getting bullied when people find out where this case is, and most importantly is it shouldn't matter to how you're going through your day-to-day life right now. I think that's the message that we're trying to get out. That we're seeing these cases going up. We know that we're going to see more and more cases. We know we're going to see, unfortunately, more severe outcomes. So now is the time to stay home. Now is the time to practice social distancing at all times. It's not the time when you hear about a case in your town. The time is now. The time is 2 weeks ago. So to anyone who is thinking that it would change their behavior, I would say again, come back to the credible information. It shouldn't change your behavior right now. Your behavior should be to stay home. But if you do have to go out for essentials, it's to practice social distancing at all time.
All right. Yesterday, the federal Indigenous Services Minister, Mark Miller, stated that there were 15 presumed positive cases of COVID-19 in Indigenous communities. Are any of those cases in Manitoba? And if a positive case were to come from a First Nation community, would the province announce that upfront?
Yeah, we don't have any reports of a case from a First Nations community in Manitoba, and we would be looking at releasing that information. Certainly, we'd work with our Indigenous partners on on how they would want that released, but we would certainly try to get that released.
Thank you.
From CJOB, Diana.
Good afternoon. It's Diana from 680 CJOB. With regards to Manitoba's second death here, I know you mentioned underlying health conditions, but was this someone who was in the intensive care unit prior to their death?
Yes, this was a client that was admitted to intensive care.
Okay, and as a follow-up, we know Manitobans are kind of struggling. They're a little overwhelmed with this. You two are really the face of Manitoba's COVID-19 response, and you're working daily. How are you guys holding up, and what do you have to say to those who are struggling as well?
Well, I mean, I think it's difficult. It's a difficult time right now, and I think it's tough on a lot of people, and certainly we're a part of a very large team, very large healthcare sector that's been trying to work day and night to to certainly limit days like this. But it's a lot of support, and I think that it's. When we see a lot of Manitobans chipping in, we see a lot of Manitobans stepping up. It's our job is made easier by that. So, Lynette, if you have.
Yeah, no, I would echo that. We have a lot of support. We have a lot of hardworking people around us, and for the people out there, I think just surround yourself with support and make sure you are a support for someone else, and just appreciate that everybody's feeling stressed and tired and disrupted and not their normal selves, and just be forgiving and accepting and take care of each other.
Thank you.
From APTN National, Kathleen.
Hi, good afternoon, Dr. Roussin. I wanted to clarify with you, on March 26th at your daily briefing, you said everyone living on First Nations in Manitoba who shows respiratory symptoms will be tested for the virus. So I hope you remember saying that. I'd like to know how many of that group have been tested.
Yeah, I don't have a number of that. What I would be saying at that time, or depending on how I worded it, is that they would be a priority group at the lab. So if the lab received the sample for that, then they would be a priority group run at the lab, and still are, and will still continue to be. Whether they're tested or not will be certainly up to the healthcare provider that they're seeing. But that would be our recommendation. They're in that priority group.
Okay, and then my follow-up is, are there enough supplies to do those tests that you would like to have done on First Nation?
Yeah, so good question. So on these supplies are the same supplies that are used every year during flu season: nasopharyngeal swab, viral transport medium. So that's there every year, and I know that a lot of testing gets done during flu season there, on many communities. And so I can't speak specifically in each community, the supplies. I know that we've worked with First Nations Inuit Health Branch and a number of Indigenous partners at our incident management structure to look at supplies, including personal protective equipment and testing supplies. So that should be in place.
Okay, thank you.
From the Selkirk Journal, Brooke.
Hi, it's Brooke with the Selkirk Journal. Dr. Roussin, the more conversations I have with family and friends in the Interlake Eastern Regional Health Authority regarding COVID-19 these days seems to be revolving around the virus's capacity to live on surfaces, such as kindling on a newspaper, a set of keys, or reusable bag, objects that are passed between people. There's a lot of speculation out there. I just wondering if you could provide some clarity and some credible information regarding everyday items that we handle.
Yeah, so I mean, most of these studies looking at how long this virus lasts on a service are done under ideal conditions, where they test it on metal surfaces, where some reports are that it could be detected up to a number of days, five or more days. Again, being able to detect the virus and whether that virus is infectious at that point are different things. But like most of these viruses, there is a chance for them to spread on fomites, on inanimate objects. And this is the big message on frequent hand washing, not touching your face or eyes, right back down to those basics, right? Staying home when you're sick, staying home if you can. But if you're out, washing your hands constantly, avoid touching your face or eyes, and that also limits the possibility of that type of spread.
Just as a follow-up, I guess if you had a choice, they say how the soap molecules will break down the lipids around the virus to eventually kill it. Is it better to leave out a box of groceries for a couple of days to let it die off, or wipe those down right away, or just focus more on the hand washing if you have to sort of cherry pick one or the other to do?
That's right, yeah. I would focus on the hand washing. Soap and water is ideal. If you don't have that, then an alcohol-based hand sanitizer.
Okay, thank you very much.
From CKDM, Matt.
Hi, Matt Hamill from 730 CKDM. You have mentioned that there would only be a release of the specific location of a positive case if there was a public health reason to do so. Could you give an example of what a circumstance would be where there would be a public health reason to detail the specific location?
Yeah, well, like for the example that we gave at Selkirk General Hospital, where we had an individual who was symptomatic for a number of days in a couple departments. So in fact, I do believe that the occupational health, infection prevention control, and public health actually were able to contact all of the contacts there, which was quite a feat. But just being there for days, we felt that there was a chance that not all contacts could be reached. So that's why we would release it there. Other times where we've had people diagnosed even within a hospital, the period of infectiousness was short. We knew where they were the entire time. We knew the contacts they had the entire time. Those people were contacted and advised what to do, but there's really no other benefit of informing other people.
Okay, thank you.
From the Otasquia Times, Trent.
Good afternoon, Trent Allen from the Otasquia Times. I'm curious if there are any testing sites being located on First Nation communities or will any be coming, and considering the limitations to travel in the north, what options are being made available for communities that have limited access, such as flying communities, to be tested?
Well, I can speak to the testing sites. So there are conversations happening right now about setting up our first First Nations testing site. And so I'm not sure where they're at with that, but I expect we'll be hearing about that in the next few days. And then about the testing sites for flying communities.
Yeah, and so those, similar to flu season, they have the ability to test and get those samples down to the lab from those communities. So again, it's how the access is built up there would be a function of that community. But we've been working with First Nations in the health branch and many partners. So testing is available. And that testing can get down to the lab just like in flu season.
Thank you. As a follow-up, with, as was mentioned earlier, just 15 cases in Indigenous communities in Canada and none in Manitoba, despite the fact there's approximately 12,000 cases in Canada, are you concerned First Nations are being under-tested or have unfair limitations to access to testing?
Well, certainly right from the beginning, we've engaged our Indigenous and including First Nation partners. Because we know that the living in remote isolated communities, especially there's certainly higher prevalence of certain medical conditions that might make you at risk, such as diabetes. And so we know these are important leaders to engage. And so certainly this virus being introduced into a remote isolated community would be a significant risk. So the testing is available. I don't know how much testing is being done, but I know there's a lot of leadership around this and at the various levels. And so I would encourage the continuance of the social distancing strategies that have been utilized in many of these communities, and to certainly encourage testing in appropriate symptomatic individuals.
Thank you. We have time for a few more questions. Do any of the reporters online have another question for our
Sorry to keep this CBC. I certainly do have one. Dr. Roussin, can you explain how you define a resolved case at this point, just so that we can all understand?
Yeah, so a resolved case would be an individual that is at least 14 days from this onset of symptoms and no longer having any symptoms. So that person would be resolved, would not have any further restrictions.
Dr. Roussin, it's Steve Lambert from the Canadian Press. Or I don't know who might best be able to answer this question, but we've seen other jurisdictions release, most recently Ontario, their projections about what might happen, the numbers we might see. It's a broad range, but it gives people an idea as to what the toll might be from COVID-19. And I think in a sense it gives people a good idea as to what the drain might be in terms of resources needed, in terms of healthcare workers, intensive care beds, etc. Are we going to see that from Manitoba? And how are we doing in terms of healthcare worker capacity, given that we've got dozens and dozens in isolation?
So yes, we are working on some modeling data, and certainly compare that. Ontario's first case came at the end of January, and our first case was March 12th. So we are behind them in our epidemic curve, and so we'll be working on that and release that when it's available. Because it's important for planning, and certainly these daily conferences here are to try to ensure Manitobans are well informed about what's happening with this. As far as the healthcare worker capacity, we're certainly aware of the implications of this, where we have healthcare workers needing to self-isolate. The move towards the universal continuous personal protective equipment is a big step towards reducing the impact of such things. And so we'll keep moving forward with that. I know, Lynette, did you want to talk about the capacity question?
Yeah, well, I think we have looked at other models. So what we want to is eventually get the information. We'll be working with the Public Health Agency of Canada just to make sure. But our numbers have been based on preliminary models, but not having gotten through a lot of cases at the time. We still need to verify, and I think it's a ever evolving as we see the cases being diagnosed, and we will get a better picture of the spread.
Larry Kush of the Winnipeg Free Press. I have a question for Lynette Siragusa. We're hearing clinics are closing today because of Shared Health's new rules on protective equipment. They can't get this equipment, apparently. What's your reaction to that?
I wasn't made aware of that, but I certainly will follow up afterwards to understand what they're not getting and how we can get it to them.
Did you say you were aware or weren't?
I was not.
Okay.
Josh Aldridge. I've got a question for Lynette Siragusa. Lynette, just wondering if you can give us an update on the blood supply here in Manitoba and if there's any talk of reducing the number of days between donations for people as well.
From what I understand, we're still at level green, which means that we're not in a crisis situation, but the supplies are on the low side. I understand that we previously put a call out for O negative, and that has been replenished, and now they're still looking for plasma. So they haven't identified to me if they've changed the criteria, but I can follow up and find out if that's in the works.
Josh Aldrich, Winnipeg Sun. I was wondering if there's been any more cases that have been identified as community-based transmission since yesterday.
So the total right now of cases that we're not able to link directly to travel or to a known transmission chain is 6. So I believe that is one more than I reported yesterday. Of course, it's early, so that investigation is probably ongoing.
Thank you. Hi, Brooke Jones, Suffolk Journal. Dr. Roussin, there was an article by Post Media posted on the Winnipeg Sun website today which explained how scientists at the University of Pittsburgh School of Medicine found a potential cure. Thoughts on that, and I'm assuming that you would recommend people not slow down their best practices to prevent this.
That's correct. So I can't speak specifically to the details of that, but during these times we'll hear of a number of these type of statements on it. So we don't have any therapy that's been proven effective against this virus at this point. So we know there's a study going on right now in Manitoba looking at hydroxychloroquine, and encourage eligible folks to review whether they want to take part in that. But as of right now, we need to maintain our focus on this virus, staying home when we can, washing our hands frequently, staying home when we're sick. And then the various public health interventions that are in place. So, anytime we hear of a potential therapy, we should be, cautiously optimistic, but we don't have a proven therapy at this point.
Okay, thank you very much for your time.
Dr. Roussin, it's Kathleen at APTN National News. What is Manitoba's plan if and when, I guess when is better, a case does present itself on a First Nation? You know as well as anyone, they don't have hospitals. They've got a health clinic, usually with a nurse and fly-in doctors every week. Well, will they need to stay there, and where would they be isolated, or would they be flown out to a city hospital? What is Manitoba's plan?
Do you want me to speak to that? So we did just have a meeting with the First Nations Inuit Health Branch yesterday, and my understanding is that there is a lot of work going on in the individual communities developing a local plan and how they would isolate people who were positive. And I think it's important to remember that 80% of people are okay to be in the community. They need that surveillance, and they need to watch what's happening. But if they do need to come to a hospital, or if they're not able to self-isolate, then we will work in partnership with FNIB and make sure that there is a plan in place for transport, and there is a plan in place to either have them in an isolated spot in Winnipeg or have them in a hospital where they need to be.
Okay, great. I'll probably follow up on that next week, but I wanted to get started on that story. Thank you.
Yeah, thank you.
Anyone else?
There was an unconfirmed report that at least one test involving one of the 2 confirmed cases in the northern region took 6 days from the time the test was administered until the results were provided back to the patient. Dr. Roussin, you had said it would take 24 to 48 hours to get the results from the time the test reaches the lab. What methods of transportation are being utilized to get the test to the lab? Is there a basic expectation for the amount of time to get the test to the lab? And is there any consideration being given for another testing site to reduce the time to get the test to the lab from northern and remote locations?
Yeah, so I mean, another testing site is not going to be practical. It takes you can see the amount of effort that CADM Provincial Lab has put in place to be able to ramp up its testing. There's some work going on point of care testing. And so that's preliminary, and so looking at that in some of these areas. And then depending on when this positive test was, the lab backlog is completed now. There were times when the turnaround time was not necessarily 24 to 48 hours. It might have been a few more days at one point. Again, anyone who has undergone a testing should be self-isolating pending results. So the delay, although not ideal, shouldn't affect outcomes. That person should be self-isolating pending their result. But we're still working on improving those turnaround times, especially trying to get those negative results called out. And then further down the line, we're looking at point-of-care testing for more remote sites.
Dr. Roussin, Brother to the CBC, can you confirm an infection of a patient, or a worker at Seven Oaks Hospital in Winnipeg?
I can't confirm that. I can find that out if there was. We've had certainly healthcare workers infected, but I can't confirm the location right now.
And can you comment on the infection at Action Marguerite Valade Senior Centre?
No, actually, I can't comment on that right now. I'm going to look into that, and then I'll have more information for you all tomorrow.
Thanks.
All right, thank you very much. That concludes today's media briefing.
Thank you.
Thank you.
Thank you.